So you guys can't see Dr. Kyle Hale. He is off camera right now, but we just poached. There he is. My wonderful hygienist and our behind the scenes editor and videographer, say hi.
Hello.
And he was not expecting that. He came in to check on us and do our thing. And now Kyle's like, oh, hey, sit down. We got to talk about patient screening. Oh. So you said, Kyle, I'm looking off camera.
But out.
Let's just be totally honest. These are my two boss. So I might start sweating, get all nervous. I mean,
dude, no way, dude. I rely on you for so many things. But Kyle came in and he was saying with our first episode that went out that he got messages hourly. How are we screening? Which I think is a really important question to talk about because, you know, we talk about it a little bit, but.
Fix your hair. I don't know if I could go a whole episode with your hair like that.
What are you talking about? You got to keep.
You got this poof over there, and it's like a roller coaster poof.
You can't edit that out. Is it better?
Oh, that's so much better. Thank you. Sorry.
That means the other two episodes, he's not going to like the way my hair looks, guys. Okay.
No, you did it just now.
Okay.
Yeah.
So, anyways, that was
all right,
funny.
let me fix this.
All
right.
No.
False start.
No. No, that was a good start.
That was a good start.
No, that's a good start.
Okay.
No, but you got hourly messages, he said, on screening. And
constantly.
Yeah.
Still
and when we were first kicking off Airway in the practice, the biggest thing was for 2 weeks. Hush. Okay. It was, okay, so how are we going to change the conversation? What are we going to ask the patients? And then what is this form they're going to fill out, right? So you can take it from there.
Skipped so much stuff.
Yeah.
Okay.
So you take it away, babe.
Well, yeah, let me help set the stage a little bit. You're a tiny little baby dentist.
Yep, I was.
Wandering around in the woods.
Yes.
You've got your street sign that says, we'll fill for student loans. We'll fill teeth for student loans at the corner of the street. And you're looking for something different to do. And it's Airway. And you have no idea where to get started.
Yeah.
And so your first question is, how do I market for Airway patients? And I just bash my head against the wall every time I see that because you don't need to market for Airway patients. Airway patients are literally sitting in your chair.
Hygiene chair.
All day yesterday, all day today, all day tomorrow. And when we were trying to help, we had an implant course and most people who know me know that I do a lot of implants, a lot less now because I focus mostly on the business. But how do you do so many implants? Like, well, how many missing teeth are coming into your practice every single day? Okay, those are all candidates for implants. Whether that's a good time to go get your reps. I like to use the word reps for how many times you get to go practice having these conversations with patients that are awkward for you and usually not awkward for them because they're the ones living with a missing tooth.
Right. And they want help.
This is Airway. This is almost, the Airway doesn't even describe what this is. We're really talking about something that
they're like, what does
has.
Airway mean? What is Airway?
So the question I want to put to you is what does it mean to have an Airway practice?
What does it mean to have an Airway
practice? What does it mean to have one? Like, just even ask the hygienist.
Yeah, that's a broad question. Ask the hygienist. So, hey, someone says, hey, you work at New Teeth Dental. That's an Airway practice. What is that? What's an Airway practice?
Ooh, so an Airway practice is like it's a dental airway practice, right? So basically what we look for besides, like cavities or any issue, what have you, but also screening, like I guess a good example is like how I screen my patient is like if I look in their mouth and there's like receding gums everywhere, there's like acid reflux or a small jaw. That's the first thing you look at, like a narrow palate. That's what we do. We screen overall, like palatal expansion and your mouth, everything all in one. So.
And then when you see that and you're like, I know, because you always come and get me and you're like, oh, the teeth are so crowded, like tongue ties, like the whole thing.
Right.
When you're talking to the patients about, because you set it up for me, I just walk in and they're like, hey, he says I need a sleep study. Like I need a sleep study. Like you're phenomenal. But like, what does that conversation look like for you when you're having to tell them like, oh, hey, this like funky toothy over here really means you need a sleep study. They're like, what?
Yeah. Well, first we do a dental health scan. I mean, you got to show them like, hey, you have receding gums. You ever wonder why?
Yeah.
Because like your wife doesn't have it, but you have it. Like I always say that. I always say that like you look at your other half, it's like they don't have this issue, but you do. So
like why?
That should like spark a curiosity as to why.
Oh,
so receding gum is like not about like, well, the number one thing people tell me in my chair is like, oh, I brush hard. I was like, well, you have receding gum on tooth number 12 and 13, but the rest is fine. So you're brushing hard on just those two teeth doesn't make sense to me, right? But if you have overall generalized receding gum, then yeah, I'll put into that like equation or list
Sure.
of things, but, not everyone has receding gums. I see 80-year-old who has receding gums, like, and then some who don't. So,
Right.
and then you kind of have to put two and two together. Not all the symptoms we see as far as like receding gums, narrow palate, all, means like sleep disorder
Sure,
breathing.
of
We
course.
got to tell our patients that.
Absolutely.
I tell my patients that.
Absolutely.
But I always tell them like, well, these are all the signs. You may or may not have it, but
Yes.
our number one first step is a sleep test.
Yeah.
Actually, no, I'll be honest. Our first step is the PEM because it's free.
Our breathing and wellness seminar.
Yeah.
That they can
Yeah.
go
Then
to.
after that, if that doesn't move you, then
Right.
so be it. Because the sleep
Right.
test takes time. It costs, obviously, but I mean, how do you know you have diabetes if you don't do a blood test, right?
Right.
That takes time and
Exactly.
blood drawn, right? So let's do a sleep test.
This is easier.
Overall health. At the end of the day, I don't say like, hey, sleep disorder breathing. Let's just like kind of know our overall health,
Right.
because that's the most important, right? And then after
Yes.
that comes,
Right.
because like we treat dentally how we can either, I don't say we cure sleep apnea, but we treat it.
No, we never say that.
prevent it, because
Yes.
prevent it means like your
Especially
kids.
in the kids.
You
Oh
fix
my
the
gosh,
kids to
100%.
prevent sleep
That's
disorder
awesome.
breathing. So
Yes.
I got to use that more.
so that's why I tell my patients like, like it's hard as enough. Like, I personally screened some of the patients who's done airway and stuff. Like, hey, tell me like how, like the first time when we told you or presented to you, how do you feel? Like, oh yeah, 9 out of 10 times they're saying it's not feasible. I mean, that's understandable, right?
Yeah.
Some of them is like, oh, that money you can put towards like a down payment for a car and stuff. And a lot of times I get like kind of like a one-on-one like conversation of like, it's kind of hard to foresee like all this time and money when you don't know if this is actually going to work, right?
Right.
So, and then we have a patient, hopefully we can get one of this one patient in maybe like to sit down and talk, because she said all this and she's like, and I asked her at the end, it's like, all that money you put and all that time, do you regret doing it? And she said no, because it helped her so much in her life.
Absolutely.
So,
I love that.
the screening is like, for me, is like looking at all the symptoms that we talk about. So stay tuned,
Definitely.
to hear all the symptoms. There's like a tree of it, like a tree of symptoms that you go through, right? And you might hit one or two things on that tree, or the symptoms, but it doesn't necessarily mean like you have like sleep disorder breathing, but it's something to be aware of, like everyone needs to be aware of. And it's our job to kind of like educate our patient, because
Absolutely.
we put a lot of time, money in learning it, and our patients should hear this, right? They're coming for that service, not just for like, yeah, we're just gonna clean my teeth. No, I don't want the dental health scan. I mean,
I know.
what are you in here for then?
Yeah.
You gotta learn. You gotta be open. I mean, we're open to
Absolutely.
hearing our patients about being holistic.
Yes.
Like
absolutely.
we're telling them how we screen patients here, because it's
And
not
we
about
want
like
we want to
cleaning
look at everything. Yeah.
everything overall
Absolutely.
health. So
Yeah.
So one of the things that I'm telling all of the doctors that are messaging me and doctors that are asking me, they're asking me two things. One, like where did we make our first change? Right. So what do we do when we went and got training? Because they all know where Callie went and got trained. She went to Vivos, and then she also did Ben's courses, Ben Morales courses. But I'm telling them, and correct me if I'm wrong, but like I'm telling them, you're not going to be able to show up and push this whole thing forwards until you have a really good conversation and essentially do a PEM for your team, and especially your hygienist, because I think the hygienists are the best qualified to understand what the heck you're talking about. And if you can't, if you don't have a good enough relationship with your hygienist to have these conversations with them and to show them what you're seeing, then you might be the problem. But
exactly. The
but
dentist.
No one wants to hear that.
Right.
But
It's true.
when Callie started doing this, walk us back through like
Yeah, that's what I was
when
going to ask
Callie
you.
showed
like-
up and you're like, you're a crazy lady. We already knew this, but now you're
No,
extra
but when we started going to the training, when you came and like, oh my gosh.
I fell asleep. No, I was kidding.
No!
I'm just kidding. I'm kidding.
My gosh.
Like kind of like the origin story for us, right?
Yes. Yeah. Like, what did you think when I was doing it? Were you like, this is terrible. I'm nervous. It had to have been a little anxiety.
Well, it's before the whole sleep thing. It was like the whole fluoride thing too.
Yeah.
Like
Here we go
I'm
with
always an
this.
open.
Yes.
I'm always an open guy.
Here we
like
go.
once you said like, oh, fluoride is bad, I was like, well, why is it bad? Like everyone's different. Like I'm very open, and like
Right.
I'll tell you this conversation I have with my patient all the time is like, typical question of my patient is like, which is better, fluoride toothpaste or non-fluoride? I was like, well, it depends on how you see fluoride. So what do you mean by which is better? It's like, oh, what is good for remineralizing teeth? It's like, Well, both is obviously right because fluoride is backed up. You know, like it remineralizes teeth, right?
Of course.
I mean, I'm not going to. I don't go into detail about that, right? But we, you know, we tell them like, hey, you know, at the end of the day, is whether you brush your teeth, you know, your diet's good. Doesn't really matter what you use, right?
Right.
But I told him like, well, you got to understand one of them is a neurotoxin. So if you know that, you know your answer now, right? I mean, it is what it is.
No, and it wasn't like you and I were walking around the hallways going, fluoride's bad. We're Exactly. It was just like, oh wow, did we know that there could be people, especially people that have genetic mutations like MTHFR, et cetera, that could be really affected by fluoride that way. Right. And so you're right. That's kind of like the biologic dentistry stuff and education for me started. And then when I found out about airway, I actually thought it was a fairly smooth transition, but I wasn't behind the scenes with y'all like what you and Tara and what people would have been talking about maybe like in those early stages.
So yeah, because so going to the sleep study, like all that, like, well, first we had to do the dental health scan first, right? And I think that helped transition that whole airway thing because we get to show our patients like as a whole, like their mouth, like, hey, you know, I see this receding gum, you see this right here, and then your palate is like really narrow and it can be expanded, stuff like that. And then it starts to be a little bit easier. But the first time we heard about this whole thing, it was like, whoa, I don't know where it's gonna take us, you know, like airways, like I know, like no one's gonna believe that, you know. Like
I think the dental health scan was my fault because we were trying to become the largest Invisalign practice in the area.
That's what happened.
Which we kind of did.
Start with the iTero scan, guys. Yeah. Like, you know.
Hey, I was going to tell people the dental health scan he's talking about. That's the verbiage that we use with patients when we do an iTero scan or a digital scan of their mouth.
Digital record.
Digital record.
Yeah. And so we do that early on. I wanted every patient in hygiene to have it every time. And then it transitioned into every patient that didn't have x-rays due, except for new patients. New patients had it done. And then,
and then we needed a lot more machines.
We have 12 treatment rooms. We have 4 iTeros. We have 4 full-time hygiene. We have 3 full-time dentists. And so maybe the time's not there anymore, but we also still do a lot of everything.
A ton of it. Those machines get abused.
Yes. So what's the cadence for doing the dental health scan right now?
Wait, sorry, what was that?
How often is a patient getting a dental health scan in our office right now?
So for me, my standard rule is it's not really like a guideline we do here, but like once a year is good.
Right.
I typically do it like probably in 6 months if I see aggressive like signs of like receding gum and acid reflux, because acid reflux does show up like in 6 months. Like I can tell you, like a couple patient already, like the little pitting on the first molar, which is like textbook, right?
Yeah.
6 months after I scanned it, it's like got bigger, you know. So like
that's awesome.
The machines are just awesome because they overlap and they'll show you the changes. Yeah. So hopefully that's made it easier for you guys.
For sure. I mean, that's the initial, like, made it transition easier rather than just talking about it, you know, like showing patients, because people like to be shown these things.
Absolutely.
Right?
So I have a question for you that I get a lot by hygienists and stuff when I talk, but what is your advice to the hygiene community now? Let's say they attended one of the Vivos webinars, they've heard me speak, whatever, but they don't have a dentist that's on board, doesn't do any airway at all. What is your recommendation to them?
No pressure.
Do you feel like if they've heard it, they know it?
You're now representing all the hygienists.
Okay, but listen, the question is, they see it, they want to talk about it. They see Torre, they want their family member. Let's say it's a family member in the chair, whatever, maybe that's a little bit easier. And the dentist doesn't talk about it or know anything about it, but they want that patient to get a sleep study done. What's your advice to them? Is it go get a new job? Because that's usually what I tell them. Find a dentist that will support you. I don't know. Has anybody ever asked you that?
No one asked me that, but I will realistically answer your question. I don't know if it's gonna be good, but okay. So let's say there's another office down the street or something like that. A hygienist is like really passionate about overall health and heard about the airway dentist and you know, airways in general. And
reaches out to you.
Reaches out to me like, hey, yeah, man, like
what do I do?
My dentist is like, nah, man, that's not what we do here. I don't think it's like, you know, it's real or whatever, you know. So
that crap doesn't work.
That crap doesn't work, right? But so I guess my best advice is set them down here. No, well, I mean, well, no, like, okay, so
you said it, guys. No.
So realistically, I feel like a dentist is like, dentists are weird, man.
Dude,
they stick to their own.
That all the time. Oh my god, I say we collectively because I'm not.
I'm saying you guys are weird. It's just you guys stick to your own ways. Like there's no telling you anything. You know.
Thank you.
It only worked for you guys because you guys have to live together. So like, okay, you do your own thing, you know, because I don't have to hear about it when I get home. But no, generally speaking, like dentists. So a realistic advice is if you can't educate the dentist about like airways, like for instance, like have them reach out to you, like, cause like you don't run the practice, you can't tell them, right? The dentist has to be on board in order to tell the hygienist or like the whole office to be like, hey, let's do this, right? Because I think if they have any questions like, hey, honestly, the realistic for me is like, if you're here in Texas, go to the PM, one of your PM, just listen. It's free, y'all. Come on, man. It's free dinner. I mean, if you show up every month, then we catch
we'll kick you out.
Yeah, we know what you're doing here. You just want that free food. But no, like, okay. In the area, like I will tell that dentist, like, hey, check out Dr. Callie Hale's like PM. Listen to it. If it doesn't move you, then whatever. That's the best advice for a hygienist, right?
It. That's true.
I have a friend. Her name is Angela Doe. She's the pediatric RDH. She went all the way down here to listen to you, and like now she's talking about pediatric sleep apnea, like it's on Instagram.
She's
and
posting stuff all the time.
She's sharing all your stuff, yeah. So it can start like that,
right?
Like a hygienist can like start sharing it,
Absolutely.
But changing a dentist's mind is like really hard. So realistically, if they won't take the initiative to like trying to like reach out to you or like go to your PM, then it is. Out of state dentists, I mean, watch our YouTube channel. Like, I mean,
and they can go to the webinars through Vivos too and listen to it. Yeah. But I get that question a lot, so I'm so happy that
it just. I mean, that's my realistic question. I mean, you can't.
He did not know I was going to ask him that today.
No, that's.
Wow. So that was perfect. If you might not know this, but I call dentists weird all the time.
Literally all the time.
All the time.
Yeah. We've seen our slew of.
Yeah.
You guys are just like too confident, and you just like, I don't know, weird. I mean, you guys know, like, there's no changing you, like.
Yeah.
It's hard.
Well, not me.
You're
Maybe
weird.
I am weird.
You're weird. Okay,
I
so
thought he loved me.
There's so many things to like look out there, like just Google search or just go to our YouTube, our website. Everything is there,
Yeah,
like,
and I know some of the hygienists that have asked that have felt like they feel now obligated to be having the conversation, and they're like, "How do I have it? How do I have it if
we
if
need
I
to
don't
start
have any
screening our
support?"
patients.
100%. It just needs to be part of the comprehensive exam, no matter what.
Comprehensive, exactly.
Well, so the reason that I grabbed you, it was not this, but this is great because you actually just earned yourself a multi-pass to guest appear here many times.
Yay! I knew that though.
Let's talk about our process. Let's get tactical. All right, let's put our boots on. Perfect. Loaded gun. This is Texas, by the way. Sorry, I think even having a finger gun in California is illegal nowadays.
Oh my gosh. We're gonna go there. No,
so, a patient walks in, new patient, whether they're here because they saw all of our awesome reviews or because they like our location, whatever it is, it's not related to airway at all, but they're going to fill out our airway questionnaire as an adult.
Right, that's
and
our
as
screening.
a kid.
Yeah.
So, you guys know this way better than me because I don't do it. So I'm going to be devil's advocate. Where'd you get these forms? What forms are you talking about?
I don't know. That's a good question.
So you can't have my forms because that, believe it or not,
it's patented. No,
people have called after some of my lectures, and our poor front desk staff has been like, "Wait, who are you? What do you need?" You can get them anywhere. They are standard. The EPSWORTH screening score, sleep questionnaire, the EPSWORTH sleep questionnaire. EPSWORTH, EPSWORTH.
EPSWORTH.
Yeah, and that's actually like a form required for medical billing if your patient's sleepiness scale,
which
basically.
we don't do, so don't ask us about it.
Well, yes we do. Oh my god!
You just said medical
ignore
billing.
him, guys. Yeah.
Oh, he's funny.
But the sleep questionnaire forms, there are a slew of them. You can tweak yours to ask certain questions, which I've done over time. I got a lot of my forms initially from Vivos, but these are medical forms. These are not reinventing the wheel. They're very simple. You can Google and get your own sleep questionnaire and sleep. What you'll find is you'll have different questions you start asking, and if they're not on the form, you'll change your form so that they asks those. Like, I think one of the ones that I needed fairly immediately was whether or not the tonsils and adenoids had been removed, because I was just asking it. Anyways, but yeah, we just got them and we use them.
Hey, real quick, can you increase my levels? Because I'm still having trouble hearing myself.
Oh.
I think it needs to go on the, I think my mic level.
Mic level. It should be this one.
Well, y'all sound way louder than me in my headphones.
Really?
So I'm thinking that push 3 and then go to the mic level. Yeah. No, increase my level. There. Check.
I can hear you loud.
A little bit, one more. Check. Okay, good. Now I don't have to talk right into the mic. Okay, thank you. All right.
You're going to have to edit all that.
God, I mean, yes.
No, you don't have to. You just
No, 100%.
This is, we can keep this raw.
Yeah, we should adjust my levels because I couldn't hear me as well as I could hear you guys. But and sorry about being snooty about medical billing. Yes, we do a lot of medical billing, but I think
just cut right to that.
I think, but what I knew as soon as that, did I say that or someone else? As soon as you said that, I knew that was going to become an instant barrier for dentists to start doing this because like, oh, my patient's going to do medical billing.
That's a completely different episode. Yeah, we should talk about that too.
But what we were talking about is a new patient come in. They're not here for the airway part, even though it is great. They just happen to land in the best airway practice on the planet, and and they're in your chair, and they've got the form, and now the forms are available anywhere. And let's just upload ours and put it on the sleepwelljourney.com website. Why not?
Oh yeah, absolutely. No problem.
Anybody.
I was joking about not giving them, but we're going to give them to you.
But in all seriousness, please don't call our office.
Oh, seriously, guys.
It's a real dental office.
Yeah. And my poor front desk staff deals with 5 full-time doctors and a hygiene and appointments, and they are not they are not your employee to give you sleep questionnaire forms. So do not call us.
And this is cool because if you're a patient listening to this or a prospective patient of any airway practice, you can see exactly what questions we're asking to have these conversations with you, or same for a dentist. So they're in your chair. You did your FMX or your 4-bite wings PAs with the CBCT, and you did your oral ID, which is how we screen for oral cancer. And then you've done your probing depths. You've done, you now know everything about them, except for the last 4 of their social.
I think we know that too, but no.
And you're ready for, I guess, the cleaning, and then when in there are you mixing in a conversation about any of this? Like, is it coming up between the time that you walk in or they walk in and before you go get the dentist, or is it simultaneous with the dentist, or is it you're going to check that before you go get the dentist and bring something up? Like, how's that work?
Are you talking about bringing up as in like the airway stuff?
The airway stuff.
Oh yeah. We'll definitely talk about airways before the doctor comes in, right? Mm-hmm. Because at the end of the day, like it's always good to talk about beforehand before a doctor walks in and just ramble about. It's like, wait, what? My last 5 minutes is going to be about this?
I know.
Do I have cavities? Like, what's going on, man? Like, you actually listed pretty much all the stuff. You were a hygienist one time, weren't you? No, no. Usually during the cleaning. Is when I like start, like in between, like before the cleaning, the scaling, before the polishing. I throw it in because, I'm probably scaling like tooth number 30 for like 2 minutes, and then I see like a receding gum or like an acid reflux or something like that, or and then later you kind of look overall mouth. So yeah, it's definitely in between. We started talking. It was like, hey, and then medical history kind of gives us a sign too, like
for sure.
On the acid reflux, right? Like you're taking like medication for it, and you're gonna ask them like, hey, how the question you ask is like, how long have you been on it though?
Yes,
because if you've been on it like majority of your life, that means when you're a kid you had it, or like when you're a teen you had it.
Yes.
So like it's not something that just started now. I mean, there are patients like, I just started, but
sure,
it's the one that I see where it started since they were young. That's like, okay, that's a sign of like sleep disorder breathing, because silent reflux, don't know if y'all know what that is, but it's another sleep disorder breathing issue, right? So symptoms. So yeah, so you kind of like look at different things, throw it in, but definitely like during the cleaning before like the doctor comes in,
because they can't talk, so you get to just talk your
exactly. Exactly. Yeah.
So and do you do your dental health scan before you do the cleaning?
I usually do it after, because I don't like scanning plaque.
Yeah. Well, because then they think it's their tooth.
Exactly. And then like you're like, oh, I forgot that part. Like no. A clean slate, because like for scaling root planning patient too, like I don't scan them until like after I clean them anyway. So but yeah, we talked about before dental health scan, but with the dental health scan, like I said earlier, it's even better because we get to talk about more. They get to see it versus like us talking over their heads. So.
I think 100%. Dental health scan has so much power, and it's one of those, it's a, depending on which one you get, it's between $30,000 and $50,000, but it's, to me, it's like it's modern practice, right? Like Who doesn't have digital x-rays anymore? Digital x-rays are better because they're faster. They take less radiation. They store forever. They don't ever distort. I mean, they don't ever like fade.
So accurate.
Right?
Yeah.
Super accurate. You can measure on them anywhere in the world. I mean, it's a super cool thing. And then this is just taking it another step further. But you keep harping on how awesome of a visual tool it is. And, you know, I'm happy to hear that, because what I kind of sense is that a dentist has a lot of barriers because they're so weird to begin with. Like I already established, they're so weird to begin with, and they actually can't get over this first step, and that's having the conversation. And maybe it's just like when you learn to read with books that had a lot of pictures in them. And so now you're going to learn to diagnose with a lot of pictures, and you can have that. For us, it's iTero. We call it dental health scan. It has an occlusogram on it, and we can show the patient like a heat map of how their teeth are coming together. And so I think this is a great tool, not just for ortho, but also for airway, because if you're breathing really well at night, you know, you're not going to have the attrition. You're not going to have the acid reflux. You're not going to have all these other signs. So I'm really glad to hear you say that you like it so much, because to be honest, like a ton of dentists ask me about that. Like, do I need to have an iTero? My answer
Oh my
is
gosh,
like,
can you
yes.
imagine if we didn't?
Man.
Can you even imagine? I don't know. I couldn't practice without it now. I don't think.
Yeah,
I mean,
you can do
you
so
remember
much,
before we had those, we had little cameras, these little, I don't
still
remember
do.
the brand. Yeah, but we barely use those now because the
Oh,
iTero
yeah.
picks up everything. But before then, it was like, hey, did you take a picture of that amalgam? Hey, there's a crack here. Did you? And we could use that visual tool. And now it's like, gosh, it's an all-in-one.
Mm-hmm.
And I think a lot of dentists are just, it's difficult for them to justify the cost of the machines because they can't see past the initial $30,000 to $50,000 they have to come up with on top of payroll and everything else they're struggling with. And it's like that alone will help the patient understand why they need their treatment.
Mm-hmm.
Your tooth's broken. This is what it looks like. And they're like, oh, that looks terrible. Yeah, we should fix that. Or, you know?
You know, it reminds me of something that you say your patients say to you, and it's the title of one of your presentations. It might be the one you give in Denver every month, but it's like, no one's ever explained it to me like that before.
Yes.
And because that is
that a book?
Callie's
No.
secret sauce. Like, do a sleep test, but then don't just call the patient or send them a fax with their diagnosis on it. Like, please, bring them in and take your time, especially if you're a baby dentist and you have all the time in the world to do this, and go through it with them. You understand it better than they do. Go through it with them. Explain what's the relevance
And
of
then don't
having
only
100
offer just
heart
one
rates.
treatment.
Oh, for sure.
Yeah.
I mean, that's my biggest thing when I teach is you better know everything. You better know about CPAPs. You better know about surgery. You better know about Spire. You better know about mandibular advancement devices, expansion, ortho, oral surgery, MMA. You know, it's like if I never, ever, ever want a patient to walk out of my consultation room after we've done a sleep study and think I'm just peddling oral appliances.
Mhm.
That's not what it's about for me at all.
So,
Not at all.
Lost my train of thought. I hate that.
It's okay. I'll pick up right here.
Yes,
No, what is it? Part of the screening too, like when I tell them like, hey, sleep disorder breathing, and they're like, oh, what if I do have sleep disorder breathing after I do a sleep test? I was like, well, you know, Dr. Callie goes over the different options. Different options means there's more than one, and
Yes.
and they like different options, right?
Yes.
But the one thing I tell them is like, hey, there's actually the cool thing about these options is that it's non-invasive. So keep that in mind versus like surgery or something like that. You know,
Right.
like because kind of imagine like you can expand palatally without, you know, like the pain and stuff like that, right? Like, because I have one myself, and it's like doing it, and of course we didn't believe in it at first, you know, because we were taught this way, but there's different options for sure. So that's the great part.
Yeah,
I think a
it's
patient
wonderful.
can appreciate it because there's obviously the highest point, the middle tier, and all
Absolutely.
that. So
Absolutely.
the night guard is probably like the worst.
Oh yeah, we need a whole thing
That's-
about night
Oh,
guards.
that's lazy dentistry 101.
Oh, he
Boom.
said it on me.
All right, go get offended.
Good. I won't be.
We're already going to offend people on this podcast. I can promise you. We haven't talked about bicuspid extraction or fixed expanders yet, so just
will.
wait. They
will.
might think we're funny right now, but I don't know if they're going to like me that much after that.
So if you're a baby hygienist or a, you know, maybe a very senior hygienist, what's something that you want to just, you know, say? I mean, what do you want to say to them?
Oh,
Run. No. Like about airway, like what would be something that would be really cool that they could look into if they wanted to? Because I think everything in dentistry can get boring. I think doing cleanings all day long on suburban patients, doing deep cleanings all day long, and a peri practice, doing peri maintenance all day long would be same thing on dentistry. Like doing fillings can get boring, extractions boring, surgery boring. Everything can get boring because it gets repetitive. We all get really good at it. We get fast at it. We get very efficient, and then it's just the same thing over and over. So as a hygienist is looking for a way that maybe they can make not pivot would probably be a really extreme word, but like how can we spice up this?
That's a hard question too.
Like paprika.
Just give them your best advice.
I mean, what are you saying? Like to like the baby hygienists, like so maybe like graduating students or something like that. You're talking about like they're just
any of them. Like let's just say like you've
been out a long time now, man. So what do you tell them?
Real long time.
Yeah, you're like old.
Must have retired.
No, stop it.
No, but like I feel like everyone has like their own niche, right? Like in hygiene, like one of our awesome hygienists, Tara, like branches to myofunctional, which plays a role. And I feel like she finds that interesting because it deals with the whole mind, body, and like everything, right? Like there's a specific way to swallow and like, all that. So
I didn't know that until like 2 days ago.
Me neither. I didn't know until like, well, not 2 days ago, but
yeah.
You know, like,
Thank you. I'm glad you knew that a little bit.
Yeah.
Listen to me.
I'll talk about myself. You know, I like this whole airway thing because I suffer from severe sleep apnea. So, I mean, it really depends on like, you know, how you start off or like, what, you know, what's going on with you to like pick up a specific niche in dental hygiene. Cause it is very repetitive, like cleaning all day. I mean, come on, like,
right.
For me, I like talking about airways because I feel like I can talk about it a lot. Maybe because I hear you too much.
Too much?
Yeah, too much. I'm like, I sound like you now, like, you know, but like it's so.
Love it.
But I'll
Start
tell you,
singing to your patients.
well, I'm getting it right now too because like every time I talk about airways, I always mention like the heart. I love human anatomy, physiology.
Right.
That's one of the courses we have to take, but like that's the whole body thing, right? Like sleep apnea. You stop breathing, you don't get oxygen in your blood. What's the only way to get oxygen in your blood in your system? Like your heart pumping it out, right?
Yeah, exactly.
So proper breathing will, you know, help that process, right? So like I love talking about the human anatomy part because that's like basic health 101. Everyone should know that. You know how to breathe. Totally. Like, oh, you know, like sleep apnea is equivalent to you running a marathon, right? So imagine you go like after you run really hard. Yeah, after you run really hard, what do? You breathe hard, right? So yeah. So I mean, for me, like that's what, you know, got me into like, hey, you know, at least I can talk about airway so my hygiene days don't seem too boring, you know. But but the one thing that really gets me like happy is like editing the video. So
I was literally, as a closer for this, I was gonna say you are 9 Petal Films, and he's sensational videographer. Absolutely. Anybody that follows me on Instagram, he does all of my content. Nobody else does any of my content. He's editing this. How did you get into videography?
Oh man, videography. You'll probably see on my website too, but like it has something to do with my honeymoon. No. So my wife was like, "Hey man, I watch too much YouTube videos." So I guess people like do things in life when they watch a certain thing, like, "Oh, that seems cool, right?" But anyways, like she was watching like all these honeymoon video from Bali and stuff, and I was like, "Oh, the cinematic take to it, like it's really cool. I like the way it looks, slow motion, speed ramping, blah blah blah." I could talk about like video editing all day. I love it. But like being able to do this for like dental, like I don't think anyone's doing it though. No, that's pretty cool.
Dude, it's amazing.
So I mean, that's how I started. My wife said, "Hey, I want you to shoot the same video, blah blah." So I had to like buy this gear and all that, kind of like learn the ropes and stuff. So over time, I was like, the thing I like most is the editing part because like you kind of hear the story, kind of like. You know, like every time I edit your video, I was like, "Oh man, this is cool. If I do it this way, it'd be awesome. What if I do this way?" But I'm still learning, though,
You're
guys.
incredible.
Like, you know,
no,
like,
he's sensational.
I'm like the bottom, you know, like.
Oh, not even, not even.
But
go follow him on Instagram, 9 Petal Films.
Yeah, if you guys don't follow me anymore, there won't be any more videos.
Please go follow him. Thank you so much. Seriously.
I mean, just still watch us too, you know, because I only do like wedding videos. I like on that 9 Petal Films and like you know family and stuff. But it's
but you're branching. It's gonna be exciting.
You know,
It's a lot of cool stuff coming, guys.
Yeah.
All right. Well, thank you so much.
Yeah, thank you. We
appreciate you more than you know.
Thanks for having me. While I go edit your videos in the background.
No, you gotta keep that on there.
Is this the outro? Okay. Well, while we're in the outro, you did say having sleep apnea is like running a marathon. Mm-hmm. So you're saying it's like a weight loss program?
Yeah, there you go.
Sweet. You definitely lose weight when you start breathing better. Are we?
No. It's when you have sleep apnea. Sleep apnea is weight loss.
No.
Yeah.
Sleep apnea.
That's what he just said.
Is weight gain.
whatever.
Pretty sure no. Sleep apnea does not weight loss. It kind of like
causes weight
it's
gain.
called loss of life.
Probably
you lose your life.
Oh.
Ba-dum, boom.
Peace out.
Oh, you had. Oh. I know. It's over
man.
somewhere.
I don't have any of the buttons set up.
All right, guys. See you the next episode.
Oh, hey, that's awesome.
Yeah.
Don't even show
There you
him
go.
those.
Yeah.
All right. That
All
was
right,
great.
That's it.
Oh.
I got nervous.
That was so much fun.